Afternoon. I'm Travis County Judge Andy Brown. Thanks y'all very much for joining us here today. We're going to hear from several folks here today. Dr. Pinkard, the medical examiner for Travis County, Dr. Walks, the medical director and health authority for Travis County and the city of Austin, Steve White, assistant chief with Austin Travis County EMS, Maggie Luna with the Texas Harm Reduction Alliance, and Phil Owen, peer recovery program manager for Communities for Recovery. But I'll kick us off. So first, I really want to thank our medical examiner and Beth in his office and his whole team for diligently working to gather all of this information that they are releasing today for their annual report. It's such an important component of what we're doing to fight this overdose problem in Travis County and trying to help us all get on the same page and see how it's all working, frankly. So today we're going to provide an overview and highlight key community findings from the 2023 Medical Examiner Annual Report. And then Dr. Pinkard will present the full report to the Commissioner's Court this afternoon. In the 2023 Medical Examiner Report, we saw an increase overall in accidental overdose deaths by 17%. And although we saw the rate of increase for accidental fentanyl-related deaths increase by 14%, for the first time in 4 years, we're seeing a slowing rate of increase. We continue to see the trend of drug overdose deaths disproportionately impacting Black and Brown communities, as we saw an increase from 2022 to 2023. Overall, 279 people died from accidental fentanyl-related overdoses, with a total of 486 accidental overdose deaths in Travis County. And although accidental drug overdose deaths continue to increase, our joint collaborative efforts for overdose prevention programs from governmental entities and community organizations are slowing the rise, and I think working in some ways that some folks will highlight. However, we still have a lot of work to do. These numbers are still unacceptable, and these statistics give us a full picture of what's happening in our community. In 2022, the Travis County Commissioner's Court declared our overdose epidemic a public health crisis, and we made significant policy and financial investments to save lives. And I think Kate Graziani is here tonight. She was, I think, the one who first called me to the meeting of the Texas Harm Reduction Alliance. It was where they could tell elected officials what is going on in the community. We heard that, and we have acted on that. And I want to thank them again for starting this work in the community for all of us. So since then, we've invested $860,000 in contracts for methadone treatment services, peer recovery support programs, and buying naloxone or Narcan. And to date, the county has distributed almost 15,000 doses of naloxone throughout the county, and I know Austin Public Health and other entities have distributed more on top of that as well. We saw a few weeks ago with the overdose surge where 9 people died and over 70 people had an overdose, that these prevention and intervention programs actually did save dozens of lives in a way that I don't know that they would have before we started all this community work. So 9 people died, which is horrible. Also, though, dozens of people's lives were saved because of intervention from public responders and just the community administering Narcan or naloxone. As we enter our budget cycle this year, we'll look at different ways to increase naloxone access in our community and continue our 3-part strategy of education, prevention, and intervention to reduce overdose deaths and support harm reduction activities and strategies. The other piece of the public health crisis that we're facing as a community that was in this report is gun deaths. Guns remain the #1 cause of non-accidental deaths in Travis County. Over 54% of suicides involved firearms, and over 82% of homicide involved a gun. And although we saw homicides decrease again this year, guns continue to be involved in the majority of cases, and this is absolutely heartbreaking. Gun violence prevention remains a top priority of this Commissioner's Court, and we're working on a comprehensive countywide gun violence reduction ecosystem that focuses on prevention, intervention, and accountability. And this year, we're launching our hospital-based violence intervention program. Its acronym is HVIP, and that's to help disrupt the cycles of gun violence by connecting survivors of gun violence with support services and help the minute that they are in the hospital. This will not only help us better understand how and why homicides and community violence are happening in Travis County, but it helps us quickly connect with victims to give them support services and care so that that cycle of violence does not continue. We still have a lot of work to do here in Travis County to address the overdose crisis, gun violence, and other findings that we're going to hear about from Dr. Pinkard. So now I want to pass it on to Dr. Keith Pinkard, who will elaborate more on the key findings, and then he'll present the full report this afternoon to the Commissioner's Court. Thank you. Yes, sir.
Thank you, Judge. I'm Dr. Keith Pinkard. I'm the Chief Medical Examiner for Travis County. And today I would like to summarize the data on drug deaths from Travis County in 2023. This is included in our annual report that, again, will be uploaded to our website this afternoon. As the judge alluded to, drug toxicity deaths or drug overdose deaths are the #1 cause of accidental death in Travis County. They account for 49% of all accidental deaths, and it is ahead of both motor vehicle related accidents and falls. As far as overdoses in general, there were 486 overdose deaths in 2023 as compared to 417 in 2022, representing a 17% increase, keeping in mind that over the past 4 or 5 years, the number of drug deaths has roughly doubled. One of the things that I really want to emphasize is that the majority of drug deaths in Travis County are not due to the presence of a single drug, but rather the presence of multiple drugs in the person's system. So about 2/3 of all drug deaths involve multiple drugs acting simultaneously. Moving on to fentanyl, there were 279 fentanyl-related deaths in 2023, up from 245 in 2022, which is a 14% increase. And again, although the number of cases is still higher, the rate by which that increased is much lower. It was a 14% increase from 2022 to 2023, but it was a 108% increase from 2021 to 2022. I'll also point out that at 279 cases for fentanyl, there were 289 cases involving methamphetamine. So methamphetamine is still a very big player in drug overdose deaths. And as far as fentanyl involvement in accidental deaths, 279 fentanyl deaths out of the 486 total overdose deaths. That means that fentanyl is present in 57% of all overdose deaths, so it is quite common. Speaking more specifically to certain age distributions, fentanyl tends to mirror the age distribution for drug deaths in general, which is roughly from the 3rd to 7th decades of life. There were in 2023 14 drug overdose deaths in people less than 20 years of age. 12 of those 14 involved fentanyl. And that was very similar to what we saw in 2022, where we had 12 individuals in that age group die of a drug overdose, and all 12 involved fentanyl. I lastly want to point out that just like with drug doses in general, cases involving fentanyl alone are extremely infrequent. Only 5% of drug overdoses in 2023 were due to fentanyl alone. The other 95% involved one or more other drugs as well. One of the most notable, as I also alluded to, was methamphetamine. So of all of our fentanyl deaths in 2023, 56% of them also had methamphetamine. So that, in conclusion, that is the summary of the drug death data from 2023. I'll be presenting overall about the entirety of the 2023 Travis County Medical Examiner annual report at the work session in a couple of hours. And then, as the judge mentioned, that report will be uploaded to the Travis County Medical Examiner website. Thank you.
Dr. Walks.
Good afternoon. My name is Desmar Walks. I'm the Travis County City of Austin Health Authority and Medical Director for APH. Today we come together to discuss the leading causes of death for residents in Austin and in Travis County. Firearms continue to be the leading cause of non-accidental deaths in our community, being used in violence and suicide. Through our Office of Violence Prevention, we're working to reduce stress that can lead to violent outcomes through our Address Your Stress campaign. We're also partnered with Lock Arms for Life to share education and distribute free gun locks that reduce the chances of accidents, self-harm, and theft within a home. Another avenue we're working on is to work with our Travis County partners to standardize surrender of firearms within our county. And it is important to remember that the survivors of violence are being taken care of in our Trauma Recovery Center that was opened last year. And this is through a partnership with the African American Youth Harvest Foundation. The center is staffed by therapists, counselors, social workers, and outreach personnel who help survivors regain their strength and rebuild their lives. We also saw, as you heard from Dr. Pinkert, the increase in drug overdose poisoning deaths last year. And the most important thing that I can stress today is that anyone who is a victim of overdose anyone who is working on their problem with drug addiction should remember not to use alone. They should have a family member or friend with them who can administer naloxone and call 911 to save their lives. We continue to work with partners to share naloxone training and education within our community. And as you can see, our efforts in community have resulted in a slowing of the rise in drug overdose poisoning deaths. And we hope to continue this work in our community with partners. Thank you.
Hello, my name is Stephen White. I'm the Assistant Chief at Austin Travis County EMS. Austin Travis County EMS has a host of programs and services that are dedicated to the mental health, suicide prevention, and the opioid use disorder problems that we're facing in our community right now. As mentioned in this report, that the number of suicides last year matched the number of traffic fatalities in our community. Of course, the appropriate number of suicides is 0 in any community, and here in Austin, our community health paramedics within Austin Travis County EMS are specially trained to deal in this mental health crisis and to respond appropriately. Every time we respond to a mental health related calls, our community health paramedics perform a suicide screening using the Columbia Suicide Rating Scale. Every community health paramedic goes through the Applied Suicide Intervention Skills Training, or ASSIST course. This is a 2-day interactive workshop in suicide first aid. It teaches the paramedics how to recognize patients at risks and to work with them to create a plan to support their immediate safety. Another angle that our community health paramedics use in mental health crisis is to really focus on the health side of mental health. We have a vast amount of resources that we can offer our clients, and it's not just limited to mental health. Our community health paramedics can assist patients with healthcare funding, housing, basic needs, provider referrals, and more. But the main topic of this report is our problem with opiates in our community. Our community health paramedics have created a separate opioid use disorder program within the community health paramedics, and it's focused around harm reduction, overdose prevention. This team focuses on identified overdoses in the 911 system, so it is a very targeted effort. They follow up on every overdose incident in the system. They offer their patients Narcan kits, training, prevention education, treatment options, and even an opioid use disorder bridge into long-term treatment with medication-assisted treatment. As we saw several weeks ago, harm reduction works. By increasing the amount of Narcan in our community and empowering the public to intervene in overdoses, we were able to limit the number of fatal overdoses we saw in the surge earlier this month. By distributing Narcan over a wide net, even actively during this event, more than 80% of the people that overdosed in the surge earlier this month received Narcan prior to an ambulance arriving on scene. Dozens and dozens of lives were saved in that effort. But in order to be successful in minimizing any kind of preventable death, we need the community's help. 2023 saw almost 200 deaths as the result of motor vehicle collisions as well, and many of these are preventable. Traffic safety is everyone's responsibility. Remember, drunk driving kills, distracted driving kills. So before you get behind the wheel after a happy hour or scroll social media in traffic, please think about the almost 200 people we lost in Travis County roadways in 2023. Nothing is worth the loss of a human life. And now I'd like to pass on the podium to Maggie Luna from Texas Harm Reduction Alliance.
Thank you. Can you hear me? Okay, hello. My name is Maggie Luna. I am the Executive Director at Texas Harm Reduction Alliance. I am here with a sense of gratitude and also urgency. The recent report from the Travis County Medical Examiner highlights a critical issue in our community. Drug overdoses accounted for 57% of the accidental deaths, totaling 486 out of 853. While this number is deeply concerning, there is a glimmer of hope. For the first time in 4 years, the rate of increase for accidental fentanyl-related overdose has slowed. This is a testament to the effectiveness of evidence-based harm reduction practices that have been implemented across our county. I want to extend my heartfelt gratitude to all who have supported these efforts. Your dedication is making a difference. However, our work is far from over. The number of deaths attributed to fentanyl and the total number of overdoses continue to rise. During the week of April 29th, Austin-Travis County EMS described an unprecedented level of opioid overdoses as a mass casualty event, resulting in the tragic loss of at least 9 community members and over 70 reported overdoses. The 2023 report indicates an overall increase in drug overdose deaths. We stand with the victims and survivors, urging our community to continue investing in and committing to resources, tools, and education that will save lives. The slowing of the percent increase from 2022 shows that harm reduction and overdose prevention efforts are working. But we must double down on these efforts, especially for our most vulnerable populations. Vocal Texas and Texas Harm Reduction Alliance recommend expanding access to Narcan and naloxone training across Austin, providing access to drug testing tools to help people identify and mitigate the risk of death, protecting those who respond to an overdose call from arrests or searches during emergency calls. Texas's current 911 Good Samaritan law excludes far too many people. Using ECHO's standards of care for harm reduction to ensure all homeless service providers and community organizations have adequate training and supplies. Training staff and program clients regularly in ensuring Narcan is available on-site at accessible locations. Adopting agency-wide overdose prevention and harm reduction policies, increasing access to harm reduction outreach teams and drop-in centers staffed by trained harm reductionists with lived experience. These measures are vital for saving lives. We hope to work closely with county and city leaders to implement these recommendations effectively. Thank you for your continued support and commitment to making our community a safer place for everyone. Together, we can reach those who are most at risk of experiencing overdose and save countless lives.
Hi, I'm Phil Owen, Program Manager at Communities for Recovery. I'm also an overdose survivor and the father that lost his son to overdose event. It's always devastating to talk about the loss of members in our community, but it's also we need to know that these were preventable deaths. That doesn't mean that we aren't making an impact. It simply means we need to make more impact. Over 75 events the week of the spike. The majority of those, I believe it was mentioned, over 80% were reversed, meaning that people survived. People survived those overdose events. And they survived because they were reversed with either rescue breathing or Narcan or naloxone. They were reversed by first responders, bystanders, and people who use drugs. The use of Narcan is working, harm reduction, and peer support is working. We just need to increase those efforts. As a call to that response, Communities for Recovery hosted the Austin Area Opioid Work Group. Within 23 hours notice, we had 215 people that showed up to that call to response to talk about strategies and emergency planning for future events. At Communities for Recovery, we strive to provide access to Narcan and trainings for those that would like more information about how to use Narcan and overdose awareness in general. Please feel free to stop by. What we do at Communities for Recovery requires lived experience. Lived experience, to qualify that, is any firsthand experience that affects you so strongly that it becomes part of your identity. That lived experience is the common ground that we use in peer support to connect with others in our community. In Travis County, through the 2 sites funded and across 20 other programs that we manage, we were able to connect with 2,387 people in 2023, and we are on track to surpass that in 2024. Connection is the key to everyone's ability to access the services they need and to save lives.
Great, thank you all very much. And one last thing, I know that we signed an agreement with Texcope a few weeks ago to try to get a better sense of who all is overdosing in the community and how many of those obviously end up in the medical examiner's office because they died. But there is a huge number of people in Travis County that overdose, that Austin Travis County EMS and Harm Reduction Alliance and others get to before that point. So I think one thing that I'm working on now is trying to, with Texcope, get a feel for year to year, how are we doing in terms of kind of the ratio of how many overdoses there are in the community and how many deaths there are. So that's one thing that we are still working on getting, although I don't know if y'all are interested in that, you can ask him more about what they're seeing. So that's our presentation for today. I want to thank y'all very much for being here and open it up to questions.
Sure. And kind of touched on it, but just straight up, what's the solution to this crisis here?
I think short term, it's getting Narcan or naloxone into the hands of everybody in Travis County that we can get it into the hands of, and educating people about what the signs are of an overdose and how you need to immediately administer it, whether you're sure they're overdosing or not, because it does not hurt anybody to get a dose of Narcan. Short term, I think that is the thing that will help us: education, getting Narcan out, and training people on it. I think longer term, it's a little more complex, but I think peer recovery services are vital, that we're investing in. Methadone and other ways to get people off of using opioids is another. I think the Mental Health Diversion Center that we're all working on together is a huge part of it, because we have a huge unmet need in our community for people who are suffering from mental health issues, who often turn to substance use, and people who have substance use issues that want to stop using them. And so once we can meet that need in the community, I think we'll be better off and safer overall, and I think we'll see these numbers go down long term. But the short-term thing that we still have to do a lot of work on is get more naloxone, more Narcan out there, and work with folks like the Texas Harm Reduction Alliance, support Austin Travis County EMS and their community health programs.
Question, this one I'll ask it in English because I think everybody's curious about it. When it comes to decriminalizing fentanyl strips, I know this is something that has been touched on last year, and I know at the legislature they have a different opinion. County level, is there any efforts to try to make that a reality, yes or no? And if so, in what way?
Thank you. And that would be, I would add that to my last response also, that fentanyl strips are a huge part of the defenses against overdoses that we do not legally have in Texas. And it's because some people in our state legislature decided that they thought they didn't want it to pass last session. My understanding is the governor and the Texas House are willing to make it legal, but the Texas Senate, led by Dan Patrick, were not willing to. And so that's a huge problem. I know that Congressman Doggett, as well as Senator Cornyn and others, want to make that legal at the federal level. We're doing everything we can to push them to do it. We can't change laws here at the local level. So we're working with our folks in the legislature to try to get that legalized next session. That would save a lot of lives.
Last year you all presented some data about correlation between people exiting our jail and overdose deaths. Are you all still tracking that data, and are there any updates there?
That's a good question. We are still tracking that data. I don't have any updates today. The one thing that we've done to try to take action on that is we're working with community care and Central Health to find ways to enroll people in MAP, which is the way they get services through Central Health and community care, while they're in jail, and then make sure that they have access to methadone while they're in jail so that they can carry on that relationship with their doctor and with methadone or whatever they need to not overdose when they leave jail, because that obviously is a big problem. People are much more likely to overdose after they've been off of opioids for some period of time in jail. So yeah, I'll get you the update on what those numbers are, but thank you for asking.
I have one for the judge and then the medical examiner, if you don't mind. Or if you can answer this, and I'm just going to answer it. I don't know if there's such thing as a good batch, but when we initially had the press conference, or it could be for ATC Mass as well, they announced, there's a bad batch going around. You think that's still out in the streets right now?
I'll let y'all take that on if you feel like, yeah.
I can say that we'll call it a batch, the batch that we were experiencing earlier in the month, we have not seen similar overdoses with the same symptoms since then. The takeaway lesson from that is a bad batch or a significantly stronger version of any sort of narcotic or non-narcotic that's laced with fentanyl could impact our community at any time. It is always going to be out there. It is a ticking time bomb that could come back and rear its ugly head in our community any moment of any day. And so our preparation is forward into that we're going to be ready for if that hits again or when that hits again, no matter what day of the week or what time of day.
I would just like to add that in light of that, if there are people who are using, they should not be using alone. And particularly if someone has been off use for several weeks or a longer period of time, they should go slow as they start again. If that's what happens and they end up starting to use again, because when you stop for any period of time and then abruptly restart and use a large quantity of medication, you can actually increase your chances of overdose. So because of the possibility of a bad batch, and because there is a possibility that you may overdose, the real take-home message for those who are suffering with addiction, living with addiction, they should be using with someone present so that they can call 911 and administer naloxone.
One more thing, George.
Yeah, go ahead.
You've heard a couple of terms up here today. I just wanted to offer some clarification. A overdose poisoning and an overdose. I need everyone to understand that when people were overdosing earlier in the month, and this is something that we have seen when we monitor how overdoses are happening in our community, people are not expecting to overdose. We heard in the doctor's report that it's not just fentanyl, it's fentanyl mixed with other things. And that's where this accidental poisoning is coming in to play, is that people are buying one product not knowing that it has opiates in it. The opiates is a surprise. So if you choose to use just understand that just because you may be purchasing or attempting to use a stimulant, that doesn't mean it doesn't have fentanyl in it. The fentanyl has worked its way into pretty much every possible combination of illicit drug out on the street right now.
You kind of answered it there, but if you don't mind, for the medical
Yeah.
examiner. So for the, it was 279, and then there's 275 fentanyl over that. 56% of them were with the meth. So if you can break down, well, obviously I see the stat for meth, but if you can tell me what you think, what type of drugs are being laced with the fentanyl.
I have really no way to assess that. You have to remember when we're running toxicology testing on samples that we collect from deceased individuals, all that our lab is able to tell is what substances are in the person's blood. So we don't know if that meant, if there were three things, for example, that might meant that they took three separate things, or that they took one thing that had three things in it. And so I have no way of assessing what any combinations might be.
I was just wondering in relation to the mass overdose earlier this month, but also just in general, have you seen that it takes more than one dose of Narcan or naloxone to bring someone back, or is one enough usually?
Yeah, I have very good data on that. It does not take more than one dose. It is one dose can kill. Whether that is what we were dealing with earlier in the month, or if that is a pill that was obtained outside of a pharmacy, we're seeing that a lot of the
One dose of Narcan to revive someone, right? She was
Pardon?
asking if it takes more than one dose of Narcan. to
Oh, more
reverse
than
it.
one dose. I'm sorry. I thought you were asking if it takes more than one dose of whatever drug you're going to take to overdose. Right. So it varies. It varies by how much drug. It varies by body weight. What I can tell you is that one dose may not wake someone all the way up, but will allow them to start breathing adequately again.
Is that generally enough, or if they start breathing a little bit, do they need some follow-up attention, or is that?
So in our training on how to administer Narcan, we always say that you're going to call 911. The goal is not to wake someone all the way up and fully reverse their overdose. The goal is to get someone who is no longer breathing because of their overdose to the point that they are breathing again. And usually one dose is all that takes. So the idea would be administer the Narcan, have the patient start breathing, and then when emergency services gets there, they can take over the patient care. And if they need to give more, if they don't need to give more, but one dose is usually just fine.
But just to follow up on your question, if you don't see that there's an adequate response, if people aren't breathing well, then you can give that second dose of naloxone.
Breakdown of demographics is gonna be in the report once published?
Yes.
If so, I'll just wait for the link, I'm refreshing, don't see it yet, but, okay. I'll wait on that, thank you.
Judge, you want to close it out?
Just want to thank all of y'all for the work that you're doing and for the attention that you're giving this, and thank y'all for covering this today. We got to keep working on it, but thank you for being here.
How much is this year, or is it, you guys, like, so far?
Oh.
We're at 2024.
We don't have a report from them yet. He was asking, do you have data for this year so far?
For the data that we're just releasing is the annual report for 2023.
Thanks. Thank you, sir.